I found that just completely changed the tone of the consultation. We immediately got off on the right foot. We normally cover the same stuff, but we could change the emphasis of what we covered, and normally it was shorter rather than longer. I practiced a very traditional model of outpatient care, but healthcare, not just outpatients, actually inpatients as well, for years and years and years. And I practiced a model that I'd been taught, a very traditional model, which went through a number of standard questions we asked everybody and then came up with a fairly standard formulation at the end of it. And I always found it really hard to squeeze everything into the time I had, particularly in an outpatient consultation when you've got 20 or 30 minutes to see a new patient and you have to go through all this stuff. And then they always come up with some question right at the end that you hadn't covered, you don't have time to answer it, and then you get crossed and they get crossed and everything's unsatisfactory. I can't remember why I changed it, but at some point about 5 years ago I changed how I did my consultations, and I started off by saying to people, I've got quite a lot of things I need to ask you, but maybe we could start by you telling me why you've come to see me and how I can help today. And that I found that just completely changed the tone of the consultation. We immediately got off on the right foot. We normally cover the same stuff, but we could change the emphasis of what we covered, and normally it was shorter rather than longer. And actually it let me off the hook in asking a whole lot of things I didn't need to talk about. It also meant that we were more like, I wanted to get the trust of the patient really early on. And for my patients who are dealing with complex epilepsy, which is my clinical specialty, they're often quite resistant to some of the treatments I've got to suggest, and their treatments are side effects, and I get that. So if we cover off what they want to do at the outset, I find it's much easier to start a conversation about the risks and benefits of certain treatments that they might not otherwise have been open to if we hadn't done it that way. I think people often really worry that personalised care is going to take too long, and they won't have time for it, and the patients will come out with a whole list of things that they want to talk about, and we're just not structured to provide personalised care. But actually, in my experience, it always takes less time to deliver a truly personalised experience rather than more. It's always shorter in the long run to focus on what they want.